Angela Nwosu is one of the biggest when it comes to reality TV and Facebook or internet production. She has broken all the records. She came in initially lying about OCP, how she's digital obanje. She has been selling a lot of things for people. I don't discuss people, right? When she was doing all that, I was just enjoying it, laughing and, having fun about what she's saying because she is getting the attention. But what made me decide to talk about it, and then with that, I'm going to throw more light so that you guys understand what the main surgery that she did is, because I feel with what she's doing, she is leading a lot of people. There are a lot of people that are trusting and believing in her reality TV. Okay? So tomorrow now, somebody that have some kind of product will come and tell her to market it, and then she will tell people that that is the reason why she lost weight. So that is where I'll have to step in as a doctor that have a platform that I discuss. If you watch me, all I pick from blogging that people do or live reality TV they do is the medical part of it. So what are we talking today? Angela did abdominoplasty. And what is this abdominoplasty? Okay, abdominoplasty is a medical or surgical procedure that you do when you feel you have a lot of scars on your abdomen and you want to get rid of it, or when you want to have that contour, you want to look good and have the figure 8 shape, right? That's why a lot of celebrities in Hollywood, now it is the in thing in Africa, everybody is going to do this liposuction. Some people do a lot of things by putting a lot of all the fat that is removed from their abdomen on their buttocks, and then they will have an hourglass shape. It would have been good for me. She didn't carry people along and do her thing. Then she comes in with elegance and beautiful shape and everything. I wouldn't say anything, because where I am angry is that she is leading a lot of young people astray. Why are you lying to them that you had a fetal demise or an abortion? Abortion doesn't mean that you have to go and do surgery. No, what it means is that a baby you have an intrauterine death, so you need to remove the baby. Why will you lie to people and tell them that you had a fetal demise and then you're doing a surgery? No, just tell them you owe nobody any explanation whatsoever. You do your thing, do your abdominoplasty. If you want to add some fat on your breast and your buttocks, and you have the hour-shaped glass. A lot of people are doing it. You don't carry people along pretending that you're doing a live video, whereas you know what you are doing. Okay, so now let us look at why people do abdominoplasty. If you are really uncomfortable, she is a social media personality. She brings her home to everybody to see. And she liked wearing skimpy things. Even when the husband took her for their wedding anniversary and things like that, she couldn't even wear her bikini to get into the swimming pool, which is okay. But as a matter of fact, I love her because she will expose her tummy. It doesn't matter whatever thing you say, because there are some scars that she have and people are really worried and like, what is going on with this scar, right? And she had already explained how she had cesarean section, how she did some surgery and they left something in her womb and all that. Those are really very traumatic events that she passed through. And I love her because she will bring out her body and still show all those scars without minding anybody or being afraid of anything. Okay? Now, how do you prepare for this liposuction? Because this is why I'm talking about this is a premeditated attempt to mislead your fans. Number one, you have to sit down with your husband and you decide, because this is a very serious surgery. This is the kind of surgery that, if you all remember Kanye West's mother, that is the surgery that she did that took her away because of the post-op complications that she had. If you all are the followers of Fashion Police, if you know the name of the Fashion Police lady, type it on the comment section. This is the same surgery that she did that took her out of this world, and they all died. Okay, so it's a very, very serious surgery that you don't just go and say, oh, I'm going to do surgery. It doesn't matter. This is something that you must have prepared. You must have talked about it. You must have gone to see the doctor. You must have discussed with the doctor, and two of you sit down and put one or two together and say, okay, you know what? This is what we are going to do. This is how we are going to do the surgery. These are the things that are going to happen. So coming to see her, do all these preparations, and then your fans that love you, no matter what you are lying to them that you are doing another thing, is where I got it wrong. Because there's a young girl out there that is going to do the same thing that she's going to do, but might not do it rightly. Okay? Now, Angela Nwosu would have sat down with her doctors to discuss the goal that she wants, okay? And her concerns, okay? To also create a custom tailored treatment plan that when she comes out, her figure is going to be hourglass. She must have also discussed it with her husband, okay? And at the end of the day, they will come to a conclusion and say, you know what, let us search and look for the right doctor that is going to do this surgery for us. So when they get this doctor, they are going to find out if this is really a doctor. Is he or she board certified? Did he do residency? And did he do other things that would have made him stand out amongst other people? Because guess what? If you go to the wrong people, that's why you see some people that do this liposuction and other kinds of surgery, and you heard that the surgery had problem. There's some chaps on the internet that did this surgery. They didn't give them proper anesthetics. They didn't give them proper pain reliever, and they were all in pain. Some of them, their buttocks busted. All right. So that is why I really need to talk about this, because if we don't talk about it and let it slide, a lot of people are going to be endangered. All right. Now, when you have identified the hospital you want to go do this surgery, all right, you have identified this doctor, you have confirmed that he is a very good, well-trained doctor, and you have also identified that, look, this is where I'm going to do my surgery. You have to do a detailed pre-operative instructions with the doctor and the team that is going to do this abdominoplasty for you. So what it means is that you are going to discuss the outcome to know that they will do a very good abdominoplasty for you. That's number one. Number two, what are they going to do with the excess skin or fat that they remove from your body? Because guess what? When they are going to do that abdomen, remember, before you even started, there's a food plan. You must have been with a nutritionist that is going to give you the food plan that you're going to take before you go for the surgery proper. Okay, so that means you must have also lost some little weight, or even more, very good weight. But what is happening is that your abdominal fat and everything doesn't just go like that. There are some people that have very high metabolism that they won't be able to lose this abdominal fat. So that is why it's not, occurring well with me. Like, why are you lying to people? This is something you must have planned from 1 year ago, or 6 months ago, or even years ago, because definitely you are an internet presenter. You like exposing your tummy. You need to get your tummy back to normal. People do it. If I start naming the celebrities in America that have done one sort of surgery or the other, is it the nose, their mouth, their lips, their forehead. There are some people that will put implants on their skin, on their muscles to have, to have the six packs. Yes. Okay. So when you have talked to them, you can tell them that, look, the excess fat that you're going to remove from my abdomen, because they are going to suction it to remove it, I need it to get to my buttocks, or I need it to get to my breast, because this is your own tissue and fats. So you're not going to have hypersensitivity reaction. Okay, you're not going to have an adverse reaction from it. When you have adverse reaction is when you get these things from another person or from a foreign body. Sometimes people's body are different. All right. So what it is that she must have discussed and said, look, because even when she came out from that surgery, I saw that her hips has also enlarged, because she has what we call gynecoid pelvis. Okay. So the gynecoid pelvis, she wanted to enlarge a little bit. There are some people that have android pelvis. This android pelvis is like that of a man. You know how men are. Not all of them. There are some men that also have gynecoid pelvis, right? So she must have agreed and said, okay, the excess fat you're going to remove, put it on my buttocks, or also do my breast so that the breast will be pointed. So there's no bad thing in it, because this is the in thing right now. People are doing, in fact, if you know the kind of constructive surgeries people are doing, you will know that what she did is just a minor thing. I have seen men that have done surgery to the point of improving and making their scrotum to be large. Yes. It's not only women that want aesthetics. A lot of people want a lot of things that when they come out, either they wear their swimming pants or everything, their crunch is going to be big, and then the woman will be like gazing. Okay, so the same way that girls want to look good, have hourglass shape, and then the men will be looking. There are some girls too that they like to see their man have a lot of this, very strong and high caliber surgeries done, so that everything will look fantastic. The only thing I haven't seen is, truthfully, surgery that will make the penis to be bigger. There's something like that you can actually do, but I haven't seen that surgery that will make the penis, the perineal organ, the long part of the penis, bigger. Okay, if the surgery about that comes up, I'll still come to my Facebook, Instagram, or my YouTube, or even my TikTok to talk about it. Okay. So now they are going to tell him about this sculptural approach that they are going to use, okay, to recreate that original contour that she will want. So when this whole thing have been planned with her and her doctors, why then would she come to the internet and lie to people that her baby, she got pregnant, and the baby, she had intrauterine death and all that? Okay, now let us talk about the day of the surgery. These are the things that she passed through. There are a lot of things. The day of the surgery, the doctor will review you, that is the patient. You have paid either with, depending on where you are, if some insurance companies take that kind of insurance to do that aesthetic surgery, you would have used your insurance to pay. But if you're paying out of pocket, you would have also paid. Some doctors back in Nigeria, you are going to pay everything because they don't want to hear any story that you didn't pay everything. But there are some people that can also sit down and say, okay, you know what? Let us break down the payment plan. They make a payment plan. Let's say every month you pay such amount, every month you pay such amount until the whole money is paid. So these are the things that she had done. So this is a premeditated lie that she is telling everybody in the internet. And it is so disgusting. Okay? Now, by the time she had discussed this with the doctor, the day of the surgery, she will come in, either lodge in a hotel near the hospital or be admitted in the hospital. It depends, because the admission, if your insurance didn't pay for that long you're going to stay before the surgery, you're going to pay out of pocket, and nobody wants to spend that kind of money. So she would have come in, and then the doctor will use a special kind of pen and do an operative marking. Okay, with that pen, they will mark the skin, and this will guide them on the kind of surgery that they do. If you have watched Botched, how many of you have watched Botched? Is a reality TV program where two doctors do surgery. If you know about Botched, comment on the comment section and let me know. If you watched it, you will see where the doctors are, marking things. These are the areas that they're going to cut, okay, to give you that hourglass appearance that you want. Okay. Now, these things must be done so that they will plan on how your skin is going to be cut off. And it will be a guide to the surgeon, because by the time they're going to put you on anesthetics, you're not going to be awake again to know what they are doing. So they would have asked you, okay, so is this what you are? Meanwhile, they would have reviewed that before now, but when you're coming, they will now draw all those things so that when they are doing the surgery, they know that they are going to do the surgery to the perfect body enhancement that you want. All right? All right, so guys, have you all watched Botched before? If you have watched Botched, comment on the comment section. Let me hear. Okay? So when you have done all that, this is also to make sure that certain things that you are concerned about, maybe, oh, doctor, so if I do this surgery, will my belly button shift from the right to the left, or will it be in the middle, or will I be, how long am I going to stay post-op and pre-op during the surgery and post-op? When am I going to wake up? These are the things that you're going to actually find out from the doctor that is doing this surgery for you. So when this has happened, you will now be taken to the theater, because this is a major surgery. It's not even like a kind of surgery that you're going to give epidural. This one, you must make the person to sleep. So you're going to give a general anesthetics. Okay? The person is going to be knocked out completely, so she or he wouldn't move a certain way or make the doctor to be, afraid that something is happening. Okay? When this has happened, they will give you anesthetic agents. That anesthetic agent is a general anesthesia that will put you to sleep. Okay? Now the doctor now starts cleaning you up, and after all the aseptic techniques are done, they will now start doing what? Cutting you. How are they going to cut you? They are not going to give you a longitudinal, or will you call it, yes, horizontal line? No, because they are trying to get rid of what's, the surgery that you have, because there are some people that did surgery before, they had a baby or had some kind of thing, and they had what we call keloid develop. All right? Or incisional scar develop. So this surgery is meant to remove every scar on your tummy, because you want to be wearing your bra and pants and get into the swimming pool, especially now that it is hot and it's sunny. Everybody wants to go out and bask themselves. Okay? So when this surgery is done, it is going to be below your abdominal area. That means it is going to be near your pubic line. You know where the pubic line is? You want me to stand up and show it to you? No, I'm not going to stand up, but it is just almost below your abdomen. You know where the line shows that this is the end of the abdomen, and then you now have your, pubic area, right? Now, he will now start removing the excess skin. By the time he's going to remove the excess skin, he's going to pull your tummy. For Angela that have a very big scar, you guys have seen her. If you have watched Angela, she has a very big scar in the middle of her abdomen. So the surgery is going to correct that, cut the two edges and then anastomose them together. But in this way, they must make sure that they will do it in such a way that there won't be any of those, incisional scar that will show. Okay? After they had done that, they will pull the abdomen downwards and stitch this place that they have cut to do the surgery. All right? After they have repaired it, and the excess skin have been removed, and soft tissues that are excess are put together, some of them are removed, and then the repair happens. Okay? Now, some doctors will go some extra lengths to use the liposuction, fat that they removed, all right, to put it at the flank of your side. All right? So that means it's going to give you a kind of hourglass shape. So this side that is, towards your hip area, they're going to put it there. And then they will also put it at the back of your hips, depending on people that have flat hips. They are going to put it there. And this will help you to give you a lean appearance, okay? To make it look natural. So that whenever anybody see you, they will think, oh, you did exercise and your shape is so out of this world. The contours are really good. You are looking fly. And whenever you pass, men are going to be like, whoa. I mean, this is the jet age. The millennials just don't want to suffer the way people are suffering. You go do surgery. That's why some people will get married. They will just go straight and do IVF. Not that they are having infertility problem. They just want to have their baby. If they want to have triplets or twins or whatever, they will just go have or people like Kim Kardashian and the sister Chloe, they got a surrogate to have their babies because they didn't want to continue working so hard, losing a lot of time that they would have used to make money, and then they use it to do exercise and then nutritional therapy and all that to get the hourglass that they need. All right? So that's why when you do these surgeries, it is kind of an easy way to get that aesthetic body that you want. Okay? So now, if you have scars, like I said before, and it is as bad as this of Angela's own, okay, the doctor will be able to arrange your skin and tissues to eliminate all those scars. You guys will see Angela when she comes out now. She is not going to have any scar whatsoever. She is going to be perfect, hourglass shape. Now, after the surgery has been done, the next thing is the recovery period. It is not easy. A lot of people do this surgery without any problem. Like this lady I told you about, I've forgotten her name. If you guys know it, just comment on the comment section. She is one of the fierce people that talk on Fashion Police. If you guys remember that name, just type it on the comment section. Everybody woke up and then heard that she is dead. She didn't die on the table while they were doing the surgery. Neither did Kanye West's mom die on the table while they were doing the surgery. It is the post-op, management, because here abroad, a lot of people go do this surgery hiding themselves. And at the end of the day, they don't have their family members. They don't have anybody taking care of them after the surgery. And when they have any complication, because there are a lot of complications that can happen, because this is a surgery that you have taken, you're going to be moribund on the bed for a long time. You're going to lie on the bed for a long time. So you're going to develop things like pulmonary embolism, and so many complications that you can't even start naming. Okay? So now, when you get to the recovery period, they've finished the surgery, they've given you the hourglass shape you want, you're looking fly now, what is the next thing you will do? You will be given, that's why I said before you go do the surgery, you must go and make sure that this doctor is board certified, is a medical doctor by profession, but then must be board certified and have done all the trainings, post consultant trainings that you need to do. The doctor must make sure that they provide you with a pen pump. All right? That pen pump will be able to dispense local anesthetics. You see, you have done you've done general anesthetics. They will still give you this thing that is going to be numbing your pain, because you're going to be in a very severe pain. So that's why some people, they do this surgery in back home. They didn't go to the right people. You hear that somebody have finished doing surgery. The person is in pain for more than how many months, how many weeks, how many, you know? So that's number one. The person must give you that anesthetics. This will be able to, number one, help you cut down the pain. Number one, also help you to cut down on narcotics. That is pain medications that you are going to be taking. So if you're taking that pump, that means they're going to train you, or if you're going to be in the hospital, the nurses will come and, you know, give you that pump, and it will continue to numb your pain until at the time when the pain threshold has gotten high enough that you're not going to feel it very pain. Then they can now tell you to take analgesics, okay, or narcotics, depending on what the doctor had decided to give you. All right. Now, this anesthetic will also help you because it's a local anesthetic. So it is just going to the point where you are feeling this pain. It's not general. It's going to also help you to stay alert. Why are you alert? So that if you are feeling something abnormal in your body, okay, let's say that a thrombi had set in, okay, or an embolus have happened, you can call. That is what happened to Serena Williams. You guys remember when Serena Williams had her first baby? She said she was feeling something that is not normal. She had an emboli. Okay, so if the doctor had not taken her in, done surgery immediately and removed the clot, that clot would have detached and probably go to her heart and knock her. And then we will hear that our most wonderful tennis player, world-class tennis player, died after surgery, after delivering her baby, a baby that she delivered without any problem, you know. And you know, she is a star, she is a competitive woman. People believe that, oh, she is so strong, so they wouldn't even want to understand that there are certain things that you can't control. Okay, so now you have done that. The doctor will now tell you the do's and don'ts of doing this surgery. All right. Number one, you must resume your non-physical work as soon as possible. What are these non-physical work? You start walking, you know, learning how to walk on time, move from one place to the other. But the part you will never do is to lift anything heavy. No, your food will be brought to you. Even if you want to cook your food, it's not going to be just that few days that you have just completed your surgery, right? And then you will be advised to avoid lifting objects, whether heavy or not. Okay? And then they will also warn you that you should avoid physical activities, okay, for several months after the surgery. That means you're not going to be running around, going to do things. No, you are concentrating on your healing process, healing time, and everything that will make you to be comfortable. All right? Now, what are the results you're going to get when you do a liposuction? Number one, you will have a very high satisfaction rate on how you look now, on how people are looking at you. This is what the Gen Z people are doing right now. Somebody will have a good breast, you have not breastfed the baby, and the person will say, no, I want to have a bigger breast. Some people don't do that. I'm not going to ask them why. That is what makes them happy. Okay? Now, you will see an expert. Okay? This expert will comprise of your board certified doctor who have received a fellowship training. You will see a nutritionist. You will see a physiotherapist that will be massaging your body, and so many other professionals, because the treatments and post-op treatments, that is the surgery and post-op treatments, is what we call multidisciplinary approach. That means a lot of doctors are going to be involved in taking care of you so that you don't get bad, so that you don't have any complications, so that you come out finer and better. And finally, you must maintain the results of a healthy lifestyle. Okay? For you to maintain this result of a good body, they cannot finish that body and then you go back to start eating any kind of food that you want, any kind of, lifestyle you want. No. The doctor is going to really explain things to you, because guess what? If you go back and start eating unhealthy foods and start being careless about what you put inside your mouth, you are going to do what? Go back to your original big, in fact, it will even be bigger size. Okay? Now, you must also have nutritious diets, because guess what? They have removed a lot of things from your abdomen. There are some people that they will go ahead to do surgery and cut off some part of their stomach. So what it means is that you need some vitamins, multivitamins to add up to help you, because you're not an older person. Those multivitamins is going to help you to get all the nutrients that you want. And aside from all the things that I have discussed, you will have some by the time you had healed, everything is gone, you are now okay. You will have a very serious physical activity. That is, you will register in a gym and continue to do your exercise. So that you have done that surgery does not mean that, oh, you're going to leave yourself. For you to maintain that hourglass shape, you are going to be doing all these exercises to make sure that everything works out well. So, what is the big deal about Angela lying about this surgery that she did? No, can anybody tell me what is the reason why you lie and tell people that, oh, no, it's not what you think. I had, initially she was telling us that she didn't want to have any baby, isn't it? She told us she didn't want to have any baby. Sound Mind and herself have decided that Ariana is the only baby that they are going to have. They are not going to have any other baby. So please, when you lie to people, also understand that in this internet, there are doctors like me. I'm not the only doctor on the internet discussing a lot of things for patients and for all the people out there that are being deceived. There are some people that will come and tell you, oh, if you take these medications, you're going to have this, you're going to do this, you're going to do that. And people have been scammed so seriously that when you hear people tell you about the scam that they got from this internet, you'll be amazed. So with what I have told you now, I hope you guys have understood that Angela Nwosu did a form of abdominoplasty. She did probably surgery to cut down her her stomach size so that she will eat less and will not be able to add as much weight as she wants. And she did a tummy tuck. It's no big deal. Come on, guys. I know a lot of people that have done, when you hear surgeries that people have done, you'll be like, oh, so this one is nothing then. Somebody will see a beautiful mouth that she has. She just wants to have a bigger mouth. Kylie did surgery on her mouth. Even as a young girl, she did a lot of fillers as a young girl, even though she hasn't even grown to the adulthood. Because when you grow, there are certain things that you added to your body that you will still naturally add. So with this, I hope you have all learned today what abdominoplasty is, what tummy tuck is, and every other surgery that is safe out there. Remember, what is important is doing a research to know the doctor that you're going to give yourself to, that you're not going to be that kind of person that you're going to be statistics of people that went to the wrong doctor and the doctor either pied you or disfigured you in such a way that I have seen people that did just ordinary surgery and they had paralysis of their lower lips. So please, when you want to do this surgery, go do your research. If the person's name is not in the internet, go to the hospital, tell the person, please, I need to see the surgeries you have done. Let me see who and who have come here to do this particular surgery. If you are not satisfied, move away from there, that Mr. A or B went and did it magu way and got saved and are alive. That doesn't mean that you are going to be alive. So when you save this your money, look for the right doctor to do this surgery. And for those that are with Angela Nwosu, please know that she is giving you the greatest. This is the greatest lie. She had done all her lies about so many things. I don't care about it. That is her own reality show. But my own is, if you want to tell people reality, you want to do a reality show, come on, you can avoid that part. Don't show them that you did surgery. You could just start showing them when you recover. Don't lie to them that you're doing another thing when you are not doing another thing. You remember when Kylie was pregnant for her daughter, the family, even though they are reality TV on internet, the family hid it. Nobody heard that Kylie was pregnant until she delivered her baby. So that's what Angela could have done. Hide that. You say you're giving us reality content, right? Do that, and don't come and deceive people and lie to them. All right. So having said that, we are now in the very, very important part of my talk show, which is the question and answer. Listen, if you're the fastest finger and you're on my live, either on YouTube or on Instagram, number one, for you to qualify to do this, you must have shared this live, you must like this live, and you must have commented to say, oh, just any comments whatsoever. Then my first question is this. Listen, I have people that have won on my life and people saw it. So I am an honored medical doctor. I cannot lie to anybody. So our parts that I love so much in this life is the question and answer part. So those that are following me on YouTube, those that are following me on Instagram, let's dive into the question. What is the name of the surgery that I mentioned now? My questions are very simple. It starts with A. Type it on the comment section. If you type this question, you're going to answer 3 questions. Very simple questions. I'm not going to give you a very hard question. If you type in the correct answer, what is the name of the surgery? There is one that starts with A, and the other one is T. So type, even if you answer one and say, oh, this is the surgery. What surgery did I say Angela Nwosu did? All right, type it on the comment section. That's number 1. Number 2, what are the things that you're going to look out for when you are making that decision to find the best doctor to give your body to do this surgery? So are you going to look for the kind of doctor that has really done so well, that have done prior surgeries before, that is board certified or have a fellowship training? Or are you going to just go and say, you're a doctor, right? Yes, you finished your first degree, you're a medical doctor or even academic doctor, please, I give you my body. Do this liposuction, do this abdominoplasty, do this tummy tuck, or any kind of surgery. So comment on the comment section. Let me hear your answer. The next and last question of the day is, when you have done this surgery, what is that one thing that the doctor will give you, okay, that will relieve your pain? These are the 3 questions. Very easy. If you were paying attention and you listened to me from the beginning of this video to the end, you must have the answer to this question. You must have. So comment on that comment section and let me know. And let me also tell you guys, for those on YouTube, you have started answering your question. The people in Instagram, I don't know why you don't want to win my giveaway. This giveaway is very mouth-watering giveaway. There are some people that have won 50,000 on this my life. There are some people that have won 50,000 naira, not meaning $50,000. There are some people that have won $100 on my life, and I send the money directly to them. So my 3 questions is, number 1, what is the name of the surgery that I mentioned? If you give me one of it, one starts with A, one starts with T, and the other one starts with okay, let's just leave the 2. Let's not go there. Just give me the 2 names of this surgery that Angela Nwosu did. Number 2 is, what are you going to look out for Are you going to just go and get any doctor and say, you know what, take my body, cut it off and give me the hourglass shape? Or are you going to say, you know what, I need a research? Doctor, are you a fellowship trained doctor? Do you have a board certification? And who have you done this surgery prior to now, so that I'll be able to see your work and know what I really want? Okay, that's number two questions. Then finally, what is the doctor going to do? What is it that the doctor is going to give you? Because I remember I said this surgery is very, very painful. What is he going to give you? Is he going to say, you know what, go home? The pain, when it comes, just put ice block on your tummy or massage your tummy to stop? Or what is he going to give you? Comment on the comment section. Now, listen, the good part of it is this. Even if you didn't answer this question now, you can actually go back, watch this video, and then comment and say, this is the things that the answers, when you give it to me and my management look at it and find all these answers that you have given. Number one, you're going to be because I'm giving 10 people this opportunity to win this big prize. Every one of you will get your money inside your account, because I will transfer the money to your account, and you're going to show the evidence that yes, you did answer questions, and yes, you did receive a mouth-watering giveaway. So why don't you be the first now and type in, or if you can't remember, go through the video and get the answers to this thing and be that lucky winner. The fastest finger, that's what I call anybody that have won my video. If you are the fastest finger, you tell me the answer, and definitely, believe you me, you are going to win the game. All right, so I'm going to stop here today. Hopefully the next time we are going to come online, we will discuss more interesting topics. Now remember, it is very, very important that we pay attention, because you don't know when my question will come. I don't ask questions at every video that I make, but if you're lucky on the time that I ask questions and you answer my questions, come on, you become a lucky winner of my giveaway. All right, so I am going to stop here. Thank you for listening, and thank you for learning something today. I had to do this video for a long time. My video doesn't last more than 30 minutes, but this one has lasted because I really needed to make you people understand what Angela did, the kind of surgery that she did. One person I love is Real Worry Picking. A lot of people were calling her so that she will be able to use the weight loss she had to use it and make money, so that product will now come and tell everybody that, oh yes, she used my product, that's why she lost weight. Real Worry Picking refused and said, look, I am going to come out here and I am going to tell people, carry them along how I do tummy tuck surgery. And she is living her best life because she is flaunting herself. No more medical issues. She told us how she lost, because there are a lot of reasons that people do surgery. Okay, do body contour and all that. It's not all about looking fly. There are some people that are suffering from a lot of medical issues, and they needed to do this surgery to get themselves back and have a better life. Okay, all right, so I'm going to stop here. Go ahead, answer my questions, and win yourself this wonderful gift. Now I am going to stop here, but before I go, I'm going to give you my doctor's orders today. You are not a rabbit to be used as an experimental animal. Before you decide to do any sort of surgery, no matter what it is, find out the doctor that is doing this surgery. Is this surgery done by a board-certified medical doctor who have received fellowship training either in surgery, for any kind of surgery that you want to do? is an OBGY doctor for people that want to deliver a baby through cesarean section, or fellowship trained doctor that has specialized in plastic surgery. That is very, very important. Don't allow yourself to be statistics. Do the right decision, get to the right doctor, and be alive to take care of your businesses, which is your family and yourself. Okay, I will end here. This is your favorite doctor, Dr. Tonia of True Health with Dr. Tonia. Thank you for watching. Ciao, ciao. Remember, answer those questions and get the giveaway. If you answer the question, send me a back channel on my Instagram messenger. Answer that question, tell me, doctor, look at it, and I have answered your question. And I guarantee you, I will send that money into your account. All you need to do is just, when I have confirmed it, you will send me your account details and I will credit your account. All right? Ciao, ciao. Bye-bye. It is so wonderful to know that, I am impacting this health for a lot of people, because it is very important that people pay attention and do the right thing. Nobody wants to see a mother or a sister die because of some carelessness from some bad people that are not even trained. And then some people will go do their surgery and lie to the poor masses that they didn't do any surgery. Why? That's so irresponsible, isn't it? All right, so okie dokie. Take care of yourselves, okay? Be kind to yourselves. Bye-bye.